Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location in Bethesda, Maryland, discussing dental implants and how they can help restore your smile and improve your dental health with one of this region's top dentists, Dr. Sheida Larijani. Dr. Larijani received her dental degree from the University of Maryland Dental School. She is a member of the Academy of General Dentistry, among other organizations, and is widely recognized as one of this area's top dentists. Welcome, Dr. Larijani.
Thank you. It's a pleasure to be here.
Oh, it's our pleasure to have you on. We've been looking forward to this interview. We've got a lot to talk about. We have a patient, Keith, who's going to be coming up a little bit later. So I wanted to begin, if I may, by asking you, doctor, if you can please tell us what dental implants are.
Dental implants are basically titanium root forms that replace the root of your teeth. They fuse with the bone, and they create a very stable platform for a new tooth to replace your missing teeth.
Now, are there different types of implants?
Yes, there are. The most common are the root form implants, and there is a different kind of implants that can be used for patients who have lost a lot of bone, but the most common form are the root form implants.
And what types of problems do these implants correct, doctor?
Dental implants are used to replace missing teeth, and they're fixed in position. They don't move, so they feel and function just like your own teeth. They also prevent your jawbone from resorption. When you don't have teeth, you have a tendency to lose bone faster. So it's a very important function of implants to keep the bone where they are. In addition to that, when you don't have teeth, the other teeth are going to move into the space. So having an implant in place and having a tooth there, it prevents your other teeth to shift and move. And most important function that they have is that it allows you to chew properly and get the nutrients that you need. And a lot of people may be missing teeth, and they don't realize that how it would impact their overall health, because they can't get the nutrients they need when they can't chew properly. One other problem that they correct is if you have loose dentures or the ill-fitting dentures, they can help secure the dentures, and it makes it a lot more comfortable for patients to function and eat.
Well, that's certainly good to know, doctor, and I wanted to follow that up by asking you, who would you say is a good candidate for the implants?
With the advances in implant these days, almost everybody is a candidate. However, we strongly recommend patients who are smoking, make sure that they quit smoking or plan to quit smoking. If a patient has diabetes, they want to make sure that the diabetes is well controlled. Okay. And basically, if anyone is healthy enough to go undergo tooth extraction, they're healthy enough to get an implant.
Okay.
And obviously, they have to be able to maintain their implant as well.
Sounds like a lot of folks can benefit from implants.
Yes, they can.
Now, what would you say, Dr. Larijani, would be a typical process that a patient would go through regarding the implants? I'm sure it varies based on the amount of work that's needed on each patient, but on average, I guess.
That's true. We take a simple case. Basically, as dentists, we review the medical history in great detail, the dental history in great detail. A patient will have all the information they need before they go through the procedure. We will take radiographs, x-rays of the entire mouth, and in most situations we have to take CT scan to make sure that there is enough bone for the implant placement. Once that's done and patient is well aware of what's going to happen, we can go ahead and schedule a patient for the actual procedure.
And how long would that procedure typically take?
The procedure usually takes about an hour.
That's it?
That is it. And it could vary based on the complexity of the situation. So if you're placing multiple implants, the patient needs additional treatment before the implants are placed, you also have to take that into consideration. But in a simple, straightforward case, it usually takes about an hour. And it's done under local anesthetic, so the patient doesn't have to be sedated, it doesn't have to go to the hospital to go under general anesthesia. A lot of times these implants are done in the office under local anesthetic.
Well, that's certainly very interesting. So this is something that literally can be done during your lunchtime, for instance, for the busy professionals.
That is possible. However, we recommend after patients get the implant to take it easy for the day.
For the day, okay.
We don't recommend them to go back to work, if they're coming at lunchtime trying to get this treatment done.
No, that's fair enough. That makes sense. But it doesn't take long at all, though.
No,
about an hour or so, like you said.
For a simple, straightforward procedure, it shouldn't take more than an hour.
And what kind of results can we expect from the implants?
The results are fantastic. Most patients don't even know that they have an implant in place. And they forget about it. They chew the way they always did. They smile they always did. And they're very happy because the implants just function and they look just like their own teeth.
So it's very natural. They get their function back, and
their speech, everything is very normal. They, like I said, patients forget after a couple of months. They forget what they had in their mouth.
How long would you say, doctor, the dental implants typically last?
Dental implants will last a long time. I want to say the lifetime if a patient really is attentive to taking care of the implants. The research shows and 97% of the implants succeed in 10 years or longer. But in my opinion, based on the experience I've had with patients who have had the implants, if they maintain it, and that means seeing their dentist on a regular basis, take the time to brush, floss, and take care of their implants, it could last a lifetime.
That's very impressive. So in other words, it's like with the regular teeth, right?
Yeah.
As long as you maintain and follow the normal guidelines that dentists stress to everyone, then you can have these beautiful implants and normal function for literally your life.
That's it. And another greatest thing about the implants is that they never get a cavity.
That's great.
You'll never need a root canal.
Oh my goodness.
So it's basically, you don't have to worry about getting cavities. However, again, goes back to taking care of the implants, which means you have to have your regular checkups and cleanings and keep the gums healthy.
Now, are there any follow-up visits that you would require of your patients after they've had the implant procedure, as far as maybe 3 months or 6 months later?
The implant procedures, when the implants are placed in the bone, we ask the patients to come back in about 3 to 4 months to make sure that the implants have taken place before we put the real tooth over the implant, the root form. After that's placed, if they have good oral hygiene and they don't have any gum disease, we recommend them to come into regular time. 3 to 6 months is fine for a healthy individual.
We're now going to meet Keith, a patient of Dr. Larijani. Welcome, Keith.
Welcome. It's a pleasure to be here.
Oh, it's our pleasure to have you. I always appreciate it when patients take time in their very busy lives to come down and share some of their experiences with us. And on that note, I'd like to begin, Keith, if I may, by asking you what dental problem or problems were you experiencing prior to coming to Dr. Larijani?
Well, prior to coming to see Dr. Larijani, I was having issues with bleeding gums. I had tooth decay. So it was, I walked into Dr. Larijani's office to have my teeth looked at and see what could be done.
And so what happened then? You came here, and what was the process you went through?
Well, when I walked into her office, it was, in order for me to continue to do my job, where I deploy sometimes overseas, I had to get dental clearance. In order to get dental clearance, I had to get my teeth looked at so there would be no complications overseas.
Yes.
So she was very thorough, went over a plan with what needed to be done in order for me to take some corrective action. And I was very appreciative that she put the time in to tell me what needed to be done.
So how long did the treatments take? Did you have to come back over a few times?
I have been seeing Dr. Larijani now for about 8 years.
Oh, a long-time patient.
A long-time patient, yes. And I have recommended my wife go. Deborah goes there as well. Even her brother saw Dr. Larijani.
Okay.
So I've been very pleased with the outcome that she has done for me.
So everything's taken care of. Your wife is happy.
Everybody's happy.
That's wonderful. And for the viewers out there that are watching, Keith, what would you tell them about Dr. Larijani and her wonderful staff?
Dr. Larijani is one of the first dentists that I've met has been honest and upfront and lays it out for you what needs to happen in order for you to have good dental hygiene.
Yes.
I was very pleased with everything that I have received. Same thing with my wife. We are very pleased with the service she provides. Her staff has been tremendous. It's almost like a family atmosphere where she actually takes concern and, with the patient, not just like you're going in there and seeing a whole bunch of different people. It's one-on-one service that she actually takes the time to do what's right.
Well, that's wonderful. And on that note, I'd like to thank you, Keith, for joining us and being a guest on our program.
Thank you very much for having me.
Our pleasure.
We're now back with Dr. Larijani.
We're literally out of time, and we only have a few moments left. I wanted to ask you, Dr. Larijani, about you, because you and your practice here, you have 2 locations in Bethesda, Maryland, where we're at today, as well as in Germantown, Maryland. Yes. So you're very convenient for a lot of folks in Montgomery County. And you and your practice have certainly established a reputation for excellence in the field of dentistry as well as implant dentistry. And I wanted to ask you, what would you say helps separate you and your practice apart from many of the others?
I can tell you that my team and I have saved and changed lives for the past 15 years. And it's our experience, in addition to the latest technology that I use in my office, help patients to get healthy, stay healthy, and the most important thing that would set me apart are really the patients. We really care for the patients. Patients are the priority. We educate them. We make sure they're comfortable while they're in the office and even after treatment. And the greatest thing is that I work with the implant surgeon very closely in my office, so patients do not have to go elsewhere to get the implant surgery done. Everything is done in the office, and I am present at the time of surgery. Almost every single surgery that we do in our office, I am present with the surgeon. And that's, I think, is the greatest thing for the patients. And again, I'm always here for the patients. And that's the number one thing.
Well, I can tell you our research has found out the same stuff that you just covered there. And Keith, who was on just a few moments ago, mentioned that at the very end, that you all treat him like a family member.
That's exactly what we do.
And I think that is huge in this day and age, not to mention the fact that you have a beautiful office. In fact, both of them are very nice. It feels like I'm at a spa, like a dental spa. You've got all the state-of-the-art equipment, really nice colors, and it's not at all like it was when I was growing up as a young man going to a dentist.
Dentistry has changed.
Yes, it has, and you all really care about your patients and treat them as if they're like family. You give them that individual attention, and you can't say that about a lot of practices, unfortunately. And on that note, I'd certainly love to thank you for joining us, being a guest in our program, really helping us to understand dental implants and the benefits of these procedures and how so many of us can really be a candidate for them and being a guest in our program again. So thank you, Dr. Larijani.
Thank you for the opportunity.
It was our pleasure.